Welcome to my channel. Please click the like button and subscribe for more videos. Stomach ulcers and what you can do about them. What is a stomach ulcer? Stomach ulcers, which are also known as gastric ulcers, are painful sores in the stomach lining. Stomach ulcers are a type of peptic ulcer disease. Peptic ulcers are any ulcers that affect both the stomach and small intestines. Stomach ulcers occur when the thick layer of mucus that protects your stomach from digestive juices is reduced. This allows the digestive acids to eat away at the tissues that line the stomach, causing an ulcer. Stomach ulcers may be easily cured, but they can become severe without proper treatment. What causes stomach ulcers? Stomach ulcers are almost always caused by one of the following: an infection with the bacterium Helicobacter pylori H. pylori, long-term use of nonsteroidal anti-inflammatory drugs NSAIDs, such as aspirin, ibuprofen, or naproxen. Rarely, a condition known as Zollinger-Ellison syndrome can cause stomach and intestinal ulcers by increasing the body's production of acid. This syndrome is suspected to cause less than 1% of all peptic ulcers. Symptoms of stomach ulcers. A number of symptoms are associated with stomach ulcers. The severity of the symptoms depends on the severity of the ulcer. The most common symptom is a burning sensation or pain in the middle of your abdomen between your chest and belly button. Typically, the pain will be more intense when your stomach is empty, and it can last for a few minutes to several hours. Other common signs and symptoms of ulcers include dull pain in the stomach, weight loss, not wanting to eat because of pain, nausea or vomiting, bloating, feeling easily full, burping or acid reflux, heartburn, which is a burning sensation in the chest, pain that may improve when you eat, drink, or take antacids, anemia, whose symptoms can include tiredness, shortness of breath, or paler skin, dark, tarry stools, vomit that's bloody or looks like coffee grounds. Talk to your doctor if you have any symptoms of a stomach ulcer. Even though discomfort may be mild, ulcers can worsen if they aren't treated. Bleeding ulcers can become life-threatening. How are stomach ulcers diagnosed? Diagnosis and treatment will depend on your symptoms and the severity of your ulcer. To diagnose a stomach ulcer, your doctor will review your medical history along with your symptoms and any prescription or over-the-counter medications you're taking. To rule out H. pylori infection, a blood, stool, or breath test may be ordered. With a breath test, you'll be instructed to drink a clear liquid and breathe into a bag, which is then sealed. If H. pylori is present, the breath sample will contain higher than normal levels of carbon dioxide. Other tests and procedures used to diagnose stomach ulcers include barium swallow. You drink a thick white liquid, barium, that coats your upper gastrointestinal tract and helps your doctor see your stomach and small intestine on X-rays. Endoscopy, EGD. A thin, lighted tube is inserted through your mouth and into the stomach and the first part of the small intestine. This test is used to look for ulcers, bleeding, and any tissue that looks abnormal. Endoscopic biopsy. A piece of stomach tissue is removed so it can be analyzed in a lab. Treating stomach ulcers. Treatment will vary depending on the cause of your ulcer. Most ulcers can be treated with a prescription from your doctor, but in rare cases, surgery may be required. It's important to promptly treat an ulcer. Talk to your doctor to discuss a treatment plan. If you have an actively bleeding ulcer, you'll likely be hospitalized for intensive treatment with endoscopy and IV ulcer medications. You may also require a blood transfusion. Non-surgical treatment. If your stomach ulcer is the result of H. pylori, you'll need antibiotics and drugs called proton pump inhibitors (PPIs). PPIs block the stomach cells that produce acid. In addition to these treatments, your doctor may also recommend H2 receptor blockers, drugs that also block acid production, stopping use of all NSAIDs, follow-up endoscopy, probiotics, useful bacteria that may have a role in killing off H. pylori, bismuth supplement. Symptoms of an ulcer may subside quickly with treatment. But even if your symptoms disappear, you should continue to take any medication prescribed by your doctor. This is especially important with H. pylori infections, to make sure that all bacteria are eliminated. Side effects of medications used to treat stomach ulcers can include nausea, dizziness, headaches, diarrhea, abdominal pain. These side effects are typically temporary. If any of these side effects cause extreme discomfort, talk to your doctor about changing your medication. Healthful diet. In the past, it was thought that diet could cause ulcers. We know now this isn't true. We also know that while the foods you eat won't cause or cure a stomach ulcer, eating a healthful diet can benefit your intestinal tract and overall health. In general, it's a good idea to eat a diet with lots of fruits, vegetables, and fiber. That said, it's possible that some foods play a role in eliminating H. pylori. Foods that may help fight off H. pylori or boost the body's own healthy bacteria include broccoli, cauliflower, cabbage, and radishes. Leafy greens, such as spinach and kale. Probiotic-rich foods, such as sauerkraut, miso, kombucha, yogurt, especially with lactobacillus and Saccharomyces. Apples, blueberries, raspberries, strawberries, and blackberries. Olive oil. Additionally, since people with stomach ulcers may have accompanying acid reflux disease, it is a good idea to stay away from spicy and sour foods while an ulcer is healing. Home remedies for stomach ulcers. In addition to eating healthy foods, the following items may help reduce the effects of H. pylori, the bacteria responsible for many stomach ulcers. However, these supplements are not intended to replace prescription medication or your current treatment plan. They include probiotics. Honey glutamine. Food sources include chicken, fish, eggs, spinach, and cabbage. Your doctor may also have suggestions for things you can do at home to relieve discomfort from your ulcer. Consider talking to your doctor about these natural and home remedies for ulcers. When should you call or see a doctor? If you think you have a stomach ulcer, call your doctor. Together you can discuss your symptoms and treatment options. It's important to get a stomach ulcer taken care of because without treatment, ulcers and H. pylori can cause bleeding from the ulcer site that can become life-threatening. Penetration, which occurs when the ulcer goes through the wall of the digestive tract and into another organ, such as the pancreas. Perforation, which occurs when the ulcer creates a hole in the wall of the digestive tract. Obstruction, blockage, in the digestive tract, which is due to swelling of inflamed tissues. Stomach cancer, specifically non-cardiac gastric cancer. Trusted source. Symptoms of these complications can include those listed below. If you have any of these symptoms, be sure to call your doctor right away. Weakness, trouble breathing, red or black vomit or stools, sudden, sharp pain in your abdomen that doesn't go away. Prevention of stomach ulcers. To prevent the spread of bacteria that might cause a stomach ulcer, wash your hands with soap and water on a regular basis. Also, be sure to properly clean all of your food and to cook it thoroughly as needed. Thank you for watching. Please subscribe for new videos and updates.